Okay. So welcome everyone. Welcome to Gift of Health Total Tuesday Wellness. And for those of you who are meeting us for the first time, I'm Dr. Shobha Rayapudi, and I'm a certified lifestyle medicine doctor and also co-founder of Gift of Health, where we actually help people struggling with chronic diseases, including but not limited to high blood pressure, heart disease, arthritis, diabetes, and other chronic conditions that we see nowadays, to break free from those diseases, reduce their dependency on medications, and have more energy through better food and lifestyle. So, and I am so excited for today's session. So, let's say if you had a choice of completing your to do list versus having restful sleep, which one would you choose? And today's session is all about like how we can revitalize our health through better sleep. And I'm so excited for our today's guest speaker, Dr. Sheila. And let me introduce her. So, Dr. Sheila Lakhoo, she is a graduate of University of Alberta, and where she completed her medical school and further trained in family medicine from University of Calgary. She also has a master's degree in health sciences, and in 2010 Dr. Lakhoo, she actually started an academic family practice at St. Michael's Hospital in Toronto and practiced there for 10 years. So she also received her board certification in lifestyle medicine. And she has also completed a professional training program through the Center for Mind Body Medicine. She has developed a lifestyle medicine program for community clinics as well as a larger organization. She's also involved in lifestyle medicine teaching, research, and advocacy to help advance this field within both medical education and primary care in Canada. And I'm so excited to have her because, as you know, like sleep is an important biological need. That is something that we cannot bypass, but a lot of us compromise on sleep, and that is a cornerstone for good health, right? So and you would be amazed at today's session. So that's why I'm so excited for this session. So welcome, Dr. Sheila Lakhoo, and I'm so excited that you are here today. uh,
Thank you. Thank you, Shobha,
yes,
for that lovely
yes.
introduction and for having me. I'm excited to be here and talk about a subject I'm passionate about. So let's get
Excellent.
started. Would you like me to share my screen
Sure.
at this
Yeah, sure.
point?
Go ahead and share
Okay.
the screen.
Okay. Now you just tell me if you are seeing the correct
Yes,
view.
I am. Yep.
So you're seeing just the
Hmm.
slides, right?
Yes. Yep.
Okay.
Yep.
Perfect. Okay. Shall I get started?
Sure. Go ahead. The floor is
Okay.
yours.
Perfect. I'm excited to be here. And as Shobha mentioned, I will be talking about sleep and how to optimize sleep for better health. So I'm a family physician and board certified in lifestyle medicine as well. Let's move this forward. So I have no conflicts of interest to declare. And really, I'm hoping that this talk will give you some really practical tips. I'm going to just briefly overview what lifestyle medicine is for those of you who don't know that. But then we're really going to, spend some time talking about why we sleep, the stages of sleep, what are the really negative health effects of poor sleep. And then I really want to spend the end of the presentation talking about practical tools and tips to help us improve our sleep, because I think that's really important. Just a quick case study. So this is like a typical person I would see in my clinic, a young, healthy, ambitious female who thinks she's healthy or says she's healthy, but has had years of trouble falling asleep, staying asleep, and is really having the consequences of poor sleep. And then she's reaching for the coffees to regain focus, is feeling very stressed, and is in this cycle of chronic insomnia. So we're going to figure out how to use lifestyle changes and the practical tips of sleep hygiene to help her reverse this. Okay. So just briefly around lifestyle medicine, many people don't like the term lifestyle medicine because it can be a bit confusing. So really how I describe lifestyle medicine is a holistic approach to chronic disease prevention and treatment, and through addressing lifestyle factors, incorporating behavior changes, and really adopting a coaching method to help empower people to make change. And we really focus on addressing root cause of illness. And lifestyle medicine also helps to optimize health and improve health span. So many people are hearing about longevity medicine, health optimization, and health span. Well, lifestyle medicine pillars such as, good nutrition, exercise, sleep optimization, social connection, stress management, and avoidance of risky substances really is the foundation for health optimization. So we're going to turn the focus of this presentation to sleep, which is a pillar that I'm really passionate about. And let's start with a poll question. Now, you don't have a poll there, but just to, ask this question, why do we sleep? So there's many reasons we sleep. Could it be to improve our memory, to learn more efficiently so we can dream, to regulate our emotional health, to support our immune system, for growth and development? Or is it multiple factors? So you probably know from this talk that it is really going to be all of the above. We sleep for many, many reasons, and sleep is not a passive stage. It is a very, very active stage. It supports our metabolic health, our immune system, and our growth and development. It also helps with our memory and learning and forming those, neural synapses in our brains. And if we want to think about creative ideas and new ways of learning, this is called memory reconsolidation. And it is really a part of sleep. So if we've got poor quality sleep, and shorter sleep duration, we're going to really affect our ability to learn and form new memories. There's also many studies linking poor sleep to cardiac outcomes. And we also know that it affects our emotional well-being, right? If you've had a bad night of sleep, you've probably noticed the next day you're not going to be feeling great. You may have a shorter fuse. You might be yelling at people a bit more, not feeling great. So it's really important to make sure we get good quality sleep. And deep sleep and the REM stages, which we'll talk about in the next few slides, is also when our brains clear out harmful toxins and removes all of those inflammatory waste products. So we really need to sleep to restore our immune system. And the other thing that it really supports is metabolic health. So you might notice that after 1 or 2 nights of poor sleep, you're reaching for the junk food. It's healthier to make healthier food choices. And this is because our sleep really affects our hormones and our hunger signals. So even if we want to make healthier choices like eating, green leafy vegetables and exercising, we're not going to do that. We're going to reach for the chocolate cake and chips when we're sleep deprived. So the research is overwhelming. There is no research that shows that we don't need enough sleep. All of the research shows we need proper sleep quantity and quality because it affects our overall health and well-being. Okay. So just briefly around the sleep cycle. So this is just, looking at the different stages where we've got N1, N2, N3, and it goes from light sleep to deep sleep to REM sleep. And REM sleep is where we're dreaming, right? So the N1, N2, N3 stages is called non-rapid eye movement. And each stage gets deeper and deeper in terms of sleep. And a typical sleep cycle from N1 to REM is about an hour and a half to 2 hours, so about 90 minutes or so. And we rotate through these cycles 4 or 5 times a night, okay? And REM sleep is where we're dreaming, right? So our brain waves increase, and that's when we get our creativity and our memories form. So it's really important to have enough REM sleep. The first half of our night, predominantly we're getting the non-REM deep sleep. And then the second half of our sleep is dominated by REM sleep. So sometimes you might notice in the early mornings or like the late night where you remember your dreams and you're vividly dreaming. That's because the REM sleep is predominant through that second half. And as I mentioned, REM sleep is very very important for emotional health and hormonal health. And it's actually one of the strongest predictors of longevity. So we know that people that have less REM sleep, less of that dreaming sleep, the higher the probability of all-cause mortality. So it's really important not only that you're getting enough sleep, but that you're going through the cycles of sleep, because they each have a very different function and important aspect of our health. Okay. So, let's talk about consequences of poor sleep. There are many, and I'm sure everyone who's had a bad night of sleep can list consequences, right? So this slide really shows that it affects all of our systems in our body. So one of the most astounding facts is that even, a few days of poor sleep can lead to blood sugar levels being in the pre-diabetic range. So it really contributes to obesity and metabolic dysfunction. So if you're trying to lose weight, or if you're a clinician and you've got patients who are trying to lose weight, they can make all the lifestyle changes in terms of nutrition and exercise, but if they're chronically sleep deprived, it is very, very difficult to regulate their metabolic health, including weight management. And this, again, is because it's got a strong effect on hormones and, again, healthy behaviors. So it's really important to make sure that people are sleeping well if they want to make healthy changes in their life. If you've got an underlying mental health disorder, such as anxiety or depression, you might notice that if you sleep less, you're going to feel more anxious. And even if you don't have an underlying mental health disorder, in the world we live in, there's a chronic state of anxiety. So we probably know that, if we're not sleeping well and we're stressed, we're going to feel more anxious. And this can also lead to worsening depression and suicidality as well. And again, it can affect our heart. It can affect, we talked about metabolic syndrome. So, it really affects every single part of our body. Okay. And, even though we know about the importance of sleep, there's a lot of people that suffer from insomnia. So about 10% of the adult general population have chronic insomnia. And more than half of people sleep less than 6 to 7 hours a night. So in my practice, one of the common complaints I get is that people are just not sleeping. So why is this? There's a lot of different things that are happening that people are not sleeping as much. We know that there's a higher rate of sleep disorder among divorced, separated, or widowed people, in the elderly. And, we also know that that the WHO has declared sleep loss an epidemic, right? A lot of people pride themselves and say, I only need 4 to 5 hours of sleep. I can get everything done. Shobha, like you were talking about all your lists, your to-do lists, and they prioritize getting things done versus sleep, right? Which really affects their health and their ability to function and their quality of life. Okay, so it's a huge problem in the industrialized world. So I'm going to focus really on insomnia because that's the most common sleep disorder, but there are many disorders. Sleep apnea is also very common. So if you snore, if you know someone who snores, has non-restorative sleep, feels really horrible in the morning, stops breathing, or has pauses in their breath at night, sleep apnea is very common. And really, you have to see a physician to get an overnight sleep study to rule that out, because it has can have severe health consequences. There's also narcolepsy, sleepwalking, night terrors. And the other big one is the circadian rhythm sleep disorder. So if you work shift work, or you're traveling a lot and you have a lot of jet lag, circadian sleep rhythm disorders is a huge issue as well. And then we've got sleep movement disorders like restless leg syndrome or periodic limb movement. So there's many types of sleep disorders, but I think we're going to focus mainly on insomnia because that is, again, one of the most common ones. And with lifestyle changes and practical tips, we can really improve quality of sleep. Okay. Oh, so insomnia. What is insomnia? So insomnia, usually people will say they either have difficulty falling asleep in spite of being in bed. So you're asleep and you're tossing and turning and tossing and turning, or waking up often in the night and having trouble to go back to sleep. So that's difficulty maintaining sleep, or waking up too early in the morning and then feeling really bad the next day. So, there are daytime consequences to people with insomnia, such as that we've mentioned, right? Concentration, brain fog, inability to perform duties. And then when it becomes chronic, all the other health consequences as well. So what is typically associated with insomnia? So think about some of these factors. Room temperature. So room temperature being cold, too much blue light exposure, stress, anxiety, physical pain, drinking alcohol at night, or all of the above. So, these are all factors that affect insomnia. And when we're actually looking at, the root cause of insomnia, and people come to my clinic and say, why can't I sleep? Well, this again is lifestyle medicine. We have to figure out what the underlying issue is. So it's really important to address the root cause of insomnia, as there are many factors as to why people cannot sleep. Some of the most common ones that people have felt during the pandemic and post-pandemic and in the busy life that we lead is anxiety and stress, right? So working too much, working late at night, drinking caffeine to stay awake, using the phone before bed, right? A big one, scrolling and then not being able to sleep. Again, shift work. If you're in physical pain, that can cause sleep. If you're on certain medications, it can cause poor sleep. There's lots of different things, irregular sleep schedules, but very commonly it can be lifestyle, stress related, and then, other factors can play in. So definitely we find that lack of routine and sleep hygiene, and then also not giving it importance, right? Taking pride, as we talked about, in needing little sleep. But these are definitely very big contributors to insomnia. So if you have insomnia or a sleep disorder, you'll go to see your physician, and usually your physician is going to do a clinical history, right? So the clinician will ask you or your partner, what's happening at night? Are you snoring? Are you waking up a lot? Physical exam is really important. Do you have heart failure? Do you have physical pain? Do you have a breathing disorder? There's sleep scales that people use, that physicians use as well. And then, of course, we talked about the overnight sleep study, right? If we're worried about insomnia or some of these other sleep disorders like sleep apnea, to go overnight to a place where you can get a sleep study, and that can tell people what the underlying disorder is. Sleep journal is also really important. And for people that have insomnia, sometimes they feel like they're not getting enough sleep, but they're actually sleeping. But so it's really important to do a sleep journal to kind of track when you're waking up, when you're going to sleep, what's happening before bed. And then the clinician might also do blood work and other investigations to rule out other causes. So, for example, people are really anemic and they've got, low hemoglobin, that can cause restless leg syndrome. So it's really important to rule out underlying causes. And then there's lots of wearable devices. So I used to use the Oura Ring as well to track my sleep. Fitbits can track sleep. So there's also wearable devices that you can use at home that are really accurate to show what types of, what your sleep is, what stages of sleep you're in. Are you cycling through? Are you waking up a lot? So if you've got one of those home devices, that's also something that we can use. And then what's the treatment for insomnia? So CBT for insomnia, which is cognitive behavioral therapy for insomnia, is really the hallmark. It is very challenging because it does involve sleep restriction for some people, but really it addresses the worry and rumination, right? So if you've been in a cycle where you can't sleep, naturally you're going to feel anxious. Oh my gosh, what's going to happen tomorrow? I'm not going to be able to sleep tomorrow. Oh my gosh, then I'm not going to be able to work. I'm not going to make it to school, whatever the consequences are. And that rumination is going to make you feel more anxious when you go to bed, which is not what we want, right? We want people to feel calm and associate bed with good quality sleep. So going through, there's lots of online programs for CBTI, but that is the hallmark of treatment for insomnia. And that really helps address the worry and rumination. And along with that is sleep hygiene. So we're going to spend the next half of the talk about around sleep hygiene and practical tools and tips. But sleep hygiene is really important because it really advises on behavior environment that will impact sleep. And then again, there's relaxation training, right? So there's practices that help us to relax close to bedtime, like imagination, guided imagery or meditation, deep breathing, things like that. So all of that can be part of the CBT for insomnia. And then again, treatment is if there's an underlying disorder, we need to treat that. And then prioritizing sleep. So what are the rules of healthy sleep? So routine is important, right? I know a lot of people, when I was younger, I didn't really need a routine. When I was in university, I could study late, I could go out, I could fall asleep at the drop of my hat, I could wake up and feel great. That changes. So, what might have been okay when you were a teenager or a young adult, as you get older, things change. There's more stressors, your body changes. So it really is important to go back to the basics and the foundation. So this slide, highlights, and you can find this anywhere online, the rules of healthy sleep. But what I like to tell my patients is to pick one or two things that really resonate, right? So pick a routine that you'll stick to, and that could be Epsom salts baths at night, light walks, yoga, journaling. So it is important to have these rules in place. And a big one that I will say is environment, right? You want your environment to be cool and dark if possible. And then going to bed at the same time, waking up at the same time. And then the other big one is screens, right? An hour before bed should not be screen time. That should be relaxation time, trying to unwind and getting back to sleep, or getting the foundations for good sleep. So in the next part of the talk, I will talk about how different things affect our sleep and some practical tools and techniques and cues that you can do during the day so that you can set yourself up for a good night's sleep. Okay. So what are the cues? What cues are there in the environment or what we do that help us regulate sleep? So all these factors like light and darkness, that's a big one, right? Circadian rhythm and sunlight, temperature, food, exercise, caffeine, and we'll also talk about alcohol as well. So all of these factors funnel into our circadian rhythm, and that really affects how alert we are. So in the morning, as soon as we wake up until about 3 to 4 hours of the day, sunlight exposure is key. So even in cloudy days, if you're tuning in from Canada, I live in Toronto, it is dark. It is not fun to get up in the morning. It's cloudy, but even sunlight for 5 minutes within the first 30 minutes will help. If you're waking up really early and there's no sunlight, you can use artificial light. And what happens is that light goes into the eyes and it signals the body to trigger cortisol. And cortisol is a signal that we should wake up and start our day, right? We don't want our cortisol to be high all day, but we want our cortisol to be high in the morning when we need to speed up our metabolism and we need to get going. So morning sunlight, if at all possible, is really going to reset our circadian rhythm. Okay. The next thing is exercise, right? So if we can exercise in the morning, even if it's like 10 minutes, maybe a quick walk around the block in the morning, now we're setting our body up to say, wake up, it's time to get up. It's going to spike our cortisol, right? So that is really important. And then even eating in the morning, right? A lot of people do intermittent fasting, but if you do have breakfast, it really sets the day that, okay, we're awake, our digestive system is working, our metabolism is working, it's time to get up, right? So these are all things that we can do in the day. And then, in the afternoon, when we want our cortisol level to start dipping so that we can get more relaxed, we want to now do things like avoiding caffeine. We might want to eat less heavy meals. We might want to avoid high intensity exercise at night because that's going to, again, stimulate us to get up. So these are just things to think about. And if you've got flexibility in your schedule, I would say try to do your high intensity activity in the morning as soon as you get up. Try to eat a bigger meal in the morning and then less throughout the day. And try definitely not to be drinking coffee throughout the day. And we'll talk about that in the next few slides. So again, this is just a slide showing us what happens to our cortisol. So the blue curve is normal. We want our cortisol to spike in the morning and gradually go down in the evening so we're ready to sleep. What happens for a lot of people is the opposite. We're sluggish in the morning, we haven't slept well, our cortisol is low, and then we have coffee and we're anxious and we're stressed and our cortisol starts to go high. Oops, it's a bedtime. Now we're in trouble, right? So we really need to reverse this. So when we get up in the morning, our body temperature naturally gets elevated, right? And this again triggers cortisol. And we really want that cortisol spike to come down, right? We know people that have high levels of stress, chronic health issues, inflammation, their cortisol does not follow this nice blue curve. What happens is you get this. So some of the things we'll talk about will kind of hopefully reset that. Again, it's all pillars of lifestyle medicine that try to help with inflammation, but a lot of these practical tips will help also shift the cortisol to the morning and have a nice dip in the evening.
So quick question here, Sheila. You can go
Yeah.
back to the previous slide. So we have a question.
Yeah.
So
Yeah.
you have shown this blue curve and one in the orange, the irregular curve. So the question is, why would we get this irregular curve as opposed to the normal curve?
Yeah. So generally with, cortisol, everyone's talking about cortisol as a stress hormone.
Mhm.
Cortisol is a stress hormone, but it's also an important hormone. What we want is we don't want it to be stressful and high all day long, which it is for most people. And the
Mhm.
biggest reason for that cortisol to be spiked and to be curved to an irregular curve is really chronic health issues, right? So chronic inflammation, if you've got metabolic condition like diabetes, if there's obesity, if there's chronic stress, right? Chronic sleep deprivation, not
Mhm.
exercising, poor diet, all those things lead to inflammation. And that
Mhm.
can all affect how our cortisol is being spiked, right? So
Okay.
generally what happens is when you get into the cycle of chronic, whether it's, diet is not great, you're not moving as much, you've got some chronic health issues, and then stress, you just kind of your hormones just get dysregulated essentially, right? And then what happens is your cortisol starts to spike towards the end of the day, and now you can't sleep at night, right?
Mhm.
So you can't sleep, you're sluggish in the morning, you're sluggish, so you're not going to get out and exercise, you're not going to see sunlight, you're going to get more coffee, you're going to eat junk food, and what happens? That curve just keeps on going that way.
Mhm.
So some of these things we're going to talk about is to help shift the curve.
Mhm.
And even one or two changes in the positive direction can help shift that curve. It doesn't happen overnight, but
Mhm.
it does happen with consistent routine. Yeah.
Yeah. Thanks,
Okay.
Sheila.
Caffeine and sleep. Oh my gosh, caffeine. So I will tell you, my husband can drink coffee till the nighttime and he falls asleep like this. And I hate it. I can't. So, I will say that caffeine, it's about timing, how much and when to stop. Okay. So if you have issues with sleep, you have to be very vigilant. The effect of caffeine in our body, the half life is up to 7 to 12 hours. So if you drink it at noon or 2 p.m., it's in your system when you want to go to bed, right? And how does caffeine work to wake us up? It's a stimulant. It's a psychoactive stimulant. It helps increase dopamine. Dopamine makes us feel good and alert, and it also blocks adenosine. And adenosine is a metabolite that accumulates in our body. So as soon as we get up and our brain starts to be active and we're starting to move, adenosine starts to accumulate in our body. And when that adenosine gets higher and higher and higher by the end of the day, that's telling us to go to sleep. So caffeine also blocks adenosine from accumulating. So we're feeling alert. Okay. So it's not that coffee is harmful or helpful. It's again the timing, right? Some people say, oh, I can fall asleep great if I drink coffee. It's not a problem. But what you might notice is that you might not cycle through the sleep cycles as good. You might not have as much deep sleep. You might not have as much REM sleep. And then the next day, you might not feel as refreshed, even though you think you have a good sleep. And so what happens? You reach for 2 cups or 3 cups. And now you're going to go into that cycle of, okay, I'm reaching for more and more coffee to stay awake. So I usually say to people, right, try to have your caffeine in the morning, ideally before 12 p.m., definitely no later than like 2, 3 p.m. And if you have problems with sleep, try to just cut it out and see what happens. Most people don't realize the effect of caffeine in our body. Okay, so that's a really important one. Alcohol and sleep. So what happens with alcohol is it can make people feel sleepy, right? So you drink and then you feel, oh, I'm sleepy. But the problem with alcohol is within the second half of our sleep, it causes arousal. So it makes you feel like you're awake. So if you've ever noticed you're going to holiday party season now, you're drinking late at night, you're probably not feeling great in the morning. And that's because you might feel sleepy initially, but alcohol really blocks REM sleep and deep sleep, and it causes fragmented sleep. So you're probably waking up throughout the night and you're waking up and not feeling great. So even one glass of wine with dinner will reduce REM sleep time. So again, the timing and dose matter. If you're drinking earlier on the day, if you've gone for brunch and you're having a glass of wine or whatever you're having at brunch, for example, you're probably going to sleep better than if you're having it at nighttime. Okay. So alcohol is a big one. A lot of people say I need a nightcap. It helps me relax to go to sleep, but they're not actually sleeping well. Their sleep is going to be hugely affected and fragmented. Okay. And then food and sleep. So it is, holiday season. People are going out and eating. And I wonder how people are feeling the next morning, right? Sorry, I just want to go back. So we know that consumption of energy rich foods desserts, refined carbohydrates, especially close to bedtime, can affect sleep. It takes time to digest food. So if you're going to bed with a belly full of these kinds of foods, it's probably going to affect sleep. It can cause heartburn. It might not make you feel good. So generally, eating a larger meal in the morning, again, that's a cue that it's morning time. It speeds up your metabolism. And then limiting heavy meals at nighttime, and ideally having your last meal around 3 hours before you're going to bed. Of course, enjoy holiday season, but just realize, maybe just notice the effects this is having on your body, so that okay, in the new year, I know kind of what happened over the holiday season. We wanted to enjoy time with family, but this is what it's doing to our health, and then we can just change behaviors in the new year. So again, ideally the biggest meal in the morning, the lightest meal at night, and generally 3 hours before you want to go to bed. I get this question a lot around THC and CBD to improve sleep quality. There's a lot of people that are using it to help sleep. And let's talk about it. So THC, so cannabis, has shown to disrupt sleep. So like alcohol, the THC blocks REM sleep. Okay. So it fragments sleep as well. The other concern about using THC for sleep is something called the withdrawal dependency. So if people are using THC for a long time and then stop using it, they can actually suffer from rebound insomnia. So really, it is, should not be used to help sleep, and it can really affect sleep. CBD, the studies are different, right? Pure CBD at lower doses, some show can cause wakefulness. Some studies show in higher dose can cause sedation. What I think CBD might help with, it might help people who are having chronic pain or using it like an oral pure CBD tincture for chronic pain or anxiety. And if your pain and anxiety are perhaps more well managed, perhaps it will help with sleep. But again, you have to be careful, because you want to make sure it's pure CBD. The dosing changes, how you respond to it can change. So it's not something I promote as first line to help with sleep at all. But be careful if you are using a lot of THC, because that is going to affect sleep. And THC can affect anxiety. I have a lot of patients who think they have an anxiety disorder, and as soon as we can get them to stop the cannabis and the THC, we notice that their anxiety disappears. So they use it to cope with anxiety, but it actually can make anxiety worse for many people. Okay. And another common question, again, around supplements. So in our bodies, what happens is we've got a gland in our brain called the pineal gland, and it releases melatonin. So as soon as the sun starts to set at dusk, what happens? We get melatonin kind of peaking, and it tells our body when it's day and night. Okay. It is not particularly helpful as a sleep aid. A lot of the randomized control studies show that it probably helps increase sleep by about 4 minutes and sleep efficiency by 2 minutes. It's not great for sleep. I think, where people could possibly use it is, in jet lag. If they're traveling, it might help. Also, studies have shown that in older adults, sometimes you can get calcification of the pineal gland, so they're not releasing melatonin. So it might help older adults with insomnia. But the big caution with melatonin is what we get over the counter, the doses are really high. So what our body releases is, like 0.3 milligrams of melatonin, for example, an optimal dose. What the over-the-counter medications are like 5, 10, 20 milligrams of melatonin. So that is really super therapeutic. And again, it's not regulated in terms of, inconsistencies of labeling of the doses and what's found in the pill, right? So you just have to be careful if you're using melatonin. And I would say try not to use it all the time. Perhaps try it if you're traveling and you need help with that. The next supplement, which is a big one in sleep, is magnesium. Now, I think magnesium has a lot of benefits. It helps with muscle relaxation. It helps with bone health. I'm a huge proponent of magnesium. What do the studies show around sleep? Well, there's no large randomized control studies that show that it does help. Magnesium threonate, which I've listed here, can have less gut issues and can cross the blood-brain barrier. So there are more studies coming out to show if it actually can affect sleep. The biggest side effect with magnesium is gut discomfort. So it can cause a lot of diarrhea and cramping. I usually do suggest magnesium for other benefits, but you got to start slow and then increase it. But again, the research around, does it actually help with insomnia? We're not 100% certain about that. But it's something you can talk to your provider with, and it's usually safe to take. It does have other benefits along with, instead of sleep. The other ones, apigenin, it's found in teas like chamomile tea. So people, drink that to find it relaxing. L-theanine is an amino acid that's found in tea and can be relaxing and help reduce anxiety and stress. And then there's things like valerian root, tart cherries. There's some small studies that show it has benefits. There's not a lot of evidence. So, overall, when it comes to supplements, my advice would be, first do lifestyle. You have to get the lifestyle and the sleep routine, pristine. You got to keep on doing that. And then perhaps you can try something like magnesium. If you're finding that there's lots of anxiety that's causing problems with sleep, we'll talk about how to address that. But you have to be careful with some of these supplements. The ones I've listed here are generally considered safe to use without a lot of side effects. So these would be the ones I would suggest. But again, always talk to your provider.
So, quick question here,
Mm-hmm.
Sheila. Coming
Yeah.
to magnesium supplement, the
Yeah.
question is, how about we get through food? So, like if we are eating foods that are naturally high in magnesium, so would that help in our sleep versus just taking the supplements?
Yes, it does help. I think you just have to be very mindful of how you're getting that magnesium and, work with a dietitian if you're not sure. But yes, if you can get it through foods, that's great. And some of these studies are actually showing, most people, if they're eating like a really healthy diet and they're getting magnesium, they're not deficient in magnesium, right? So you should be able to get it through your food. But a lot of people need extra because they're just not getting it. So if you are getting enough magnesium, that's great. The other thing I say to people, Epsom salts is high in magnesium. You can put in a bath and it gets absorbed. Magnesium gets absorbed better through the skin. So you can get like a magnesium cream or Epsom salts bath, and that can help boost it. But yeah, if you're eating a lot of magnesium, you might not need a supplement.
Mhm.
Okay.
Thank you.
Sleeping pills. So as a clinician, I mean, I have prescribed sleeping pills. I often do, but it is in a limited kind of duration and if needed. And it's always in conjunction with sleep hygiene and lifestyle changes. There's lots of side effects with sleeping pills. We have to be careful as you get older because it causes increased risk of falls, memory issues. It can cause a lot of dependency. So usually if, someone comes to me and they're having a really tough time, they've, they've had a family member that's ill or something's happened and they just can't sleep and they need to sleep, we will use it for the lowest duration of time. So if you're thinking about sleeping pills and you're going to see your physician, make sure that first you've had kind of all the sleep hygiene stuff, refer back to this presentation, talk to your clinician around, the lifestyle changes in sleep hygiene and supplements before going to sleeping pills. Okay. And then let's talk about nighttime awakening. So again, a lot of people can fall asleep easily, fall asleep, but I'm awake. I'm awake a lot. I can't go back to sleep or I wake up early. So again, what is the cause of this? Is it because you're in pain? Are you drinking a lot of fluid? And so now you're up all night peeing, right? Is your environment too hot? Do you have a snoring partner? Are you waking up at 3 a.m. with a list of things you have to do, right? So remember that we all, once we go through that sleep cycle, we all move over and turn over. We might all open up our eyes, but we won't really remember what's happening. So we do move over, in our bed, we might open our eyes. But the issue is when you wake up and can't go back to sleep, right? Because it can cause fragmented sleeps. So remember, whatever happens, do not take out that phone. Do not use, do not expose yourself to blue light and do any stressful activities. Excuse me. So the biggest thing is take a few deep breaths, read a book, optimize sleep hygiene. Sorry, excuse me, I have a bit of a cough here. And then, we'll talk about what you can do as well in terms of the anxiety and the journaling as well to help minimize nighttime awakenings. Okay, what is the best position for sleep? So this depends on pregnancy, right? If you're pregnant, you're going to be sleeping on side. You're not going to be sleeping on your back or your belly. If you've got sleep apnea, back pain, if you've got reflux, people might be sleeping upright. So really the best sleep position for you is whichever sleep position enables you to enjoy a restful night of uninterrupted sleep and wake up in the morning feeling refreshed without any aches and pains. So if you don't have to change your sleep position, right? Unless you've got certain conditions like the ones I've listed. And then naps. There's a lot of individual variation in tolerance for naps, and it's a bit of a double-edged sword. So if you struggle with sleep at night, I would say try to avoid napping during the day so you can build up sleepiness and your sleep drive. If you have, or if you really do need to sleep, make sure that the naps are short and early on, so not in the afternoon. If you sleep great at night and you're used to napping regularly and you feel good in the morning and you sleep well, nap, right? Go for it. But again, keep your nap short, under 30 minutes. A lot of cultures, right, have the siesta and they sleep in the afternoon and they feel refreshed, and that's great. But keep it brief, and, ideally kind of early afternoon, at least 7 to 8 hours before you want to go to bed. Okay. I want to talk about some common sleep myths. So these are things I hear a lot, from friends, from patients. I catch up on sleep on the weekend. I just sleep 12, 14 hours on the weekend. I'm fine. Well, if you're catching up on sleep on the weekend, that probably means you're really sleep deprived during the weekday. And there's no such thing as really catching up on sleep, as we know that days and days of sleep deprivation have profound impacts on health. So even a few days of sleep deprivation has profound effects. So, we really try to say, even on the weekends, go to bed at the same time, wake up at the same time, kind of within an hour or so. So if you're catching up on sleep on the weekend, that means you're probably sleep deprived during the weekday, right? We should all sleep like a baby. Well, if any of you have had children, we know that babies don't always sleep well. They're sleeping a lot of hours, but it's fragmented, right? And they're up all the time, eating, sleeping. But if you have a teenager or know a teenager, you probably know that they go to bed and nothing can wake them up, right? They just sleep. So, part of it is that we want to be sleeping like teenagers. Now, I don't know, with the advent of social media and phones, when I was growing up, there was no such thing. We just all slept, right? But now probably teenagers are not sleeping very well, right? Because of social
You're
media.
right.
So
Yes. And
that's changing.
yes, teenagers have a lot of sleep problem, and it's really interesting to see, like, even their stress levels is very high, and they have,
Yeah.
I mean, a lot of problems sleeping. The things that we see commonly in adults, it's now we are noticing in teenagers. Yeah.
Yeah, I want to echo that for sure, right? The amount of teenagers that come see us for anxiety and in a lot of different things, that we weren't seeing 20, 30 years ago. So,
Yep.
I should have caveated that sleeping like a teenager back in the 70s.
But yes.
Right? But you're
Yes.
right. Yeah.
Yeah.
And again, if teenagers are facing such issues early on with sleep, the effects of that on their chronic health is going to be huge, right? So we really need to address it.
Mhm.
Another myth, we need less sleep as we get older. Sure, compared to a baby who sleeps, 21 hours, and then, teenagers who might need more sleep, but we still typically need 7 to 9 hours of sleep, of restorative sleep, right? And as you get older, we do have less deep sleep and we're more arousable compared to children and teenagers. So things will wake us up a bit more, but we still need that amount of sleep. There's a lot of people in my references, I'll talk about Matthew Walker, who's, PhD and expert in sleep. There are people that have a chronotype that really can get away with 4 hours. But most people think they have that chronotype and they do not. So I would say you probably don't have that chronotype. You need 7 to 9 hours. And there's actually more evidence that women need more sleep because of hormonal regulation, right? Women's hormones really depend on the time of the month it is, if they're in the reproductive stage, menopause, perimenopause. So it's shown now that women actually probably need up to 10 hours of sleep, of restorative sleep, compared to men. Okay. And then ask yourself these questions, right? Do I fall asleep reading quietly in the afternoon? Am I drifting off in meetings? Am I falling asleep watching TV? Are you in the passenger side of the car and falling asleep? And if you've answered yes to these, that means you've probably got an underlying sleep disorder. or you're not getting enough sleep, right? So it is not normal to fall asleep if you're reading quietly. Okay, it is not normal to drift off in afternoon meetings unless they're really boring or
So the
watching
thing
TV.
is, like, it is actually yes to all of these. So, yes, falling asleep while watching TVs, sleeping while you're in the passenger seat in the car.
Oh,
I mean, like when I was looking at this, yes, I mean, it is yes for everything.
you need to sleep more, Shobha. You need to sleep more. But a lot of people who have busy lives, right? You're just go,
Yes.
go, go, go. And you're not, and then boom, you're falling asleep in places where you
Yeah.
shouldn't be, right? So this is just to flag it to say, okay, if this is happening, let me
Mhm.
maybe prioritize sleep and figure out a few things that can help me sleep better so you're able to get through a TV show. Okay. So just in terms of kind of my tips for restful sleep, I think the biggest thing, is sun and movement, right? So if we can get out in the sun and stack that Q, it's really hard in North America, I know. But as soon as we get up, if we can even just step outside for 5-10 minutes, that's going to help set our circadian rhythm, keep moving, and then have a nighttime routine. What works for me might not work for you, right? So pick something that is relaxing to you. For some people, journaling is relaxing. It can get down their thoughts. And if you've got that ruminating mind, there's a lot of evidence that journaling can help. For some people, it's doing artwork, yoga, fun reading, not listening to the news, not reading medical journals, something that's relaxing, unless you find medical journals relaxing. But find a nighttime routine that works for you, because then you're going to stick with it and you're going to find it enjoyable, right? Caffeine, big one. If you can stop caffeine, if you're having trouble sleeping, stop caffeine and see what happens, right? Use your body as an experiment. Otherwise, definitely after 12 p.m., I'm pretty conservative. I say, if you're having trouble sleep, stop caffeine after 12 p.m. Avoid alcohol before bed and blue light. It's the biggest thing, right? A lot of us keep our phones in our room because we're listening to a meditation or alarm clock. But, the sleep experts say keep the phone out of the room, because if you wake up, the last thing you want to do is pick up the phone. Always have a stress management toolbox. There's lots of resources online. If you've got access to a therapist, in an environment of chronic stress, things that are happening in this world, we just need stress management tools. And the more tools we have in our toolbox, the better it is when things get hard for us. Environment. I keep it at like 18 degrees. I have a fan going. I have the AC going, and I need it very cold. But that's because the body actually does better when it's very cold, right? So you want the environment to be cool, dark, quiet, and comfortable. So if you can have a fan going with white noise, keep the window a little bit open in the winter, and really have the room cold, it's going to hopefully minimize some of those awakenings. And then the 3-2-1 rule. So I just heard about the 3-2-1 rule. My dad told me about it. I was like, what's the 3-2-1 rule? He said 3 hours before sleep, not eating, 2 hours before sleep, not drinking fluid, so you're not getting up to void, and 1 hour before bed, no screens. So I generally say that, but I never thought about 3-2-1. So think about those things. And don't feel anxious that you have to do all of these at once. Ideally, you do stack them because that's better, but pick a few things. And then as you get good with maybe, okay, I'm getting really good at getting up in the morning and moving in the morning. I'm not good with my nighttime routine. So let me in the new year start working on my nighttime routine, right? So pick one or two things that resonate with you and then see. And if you've got a tracking device, use that as an experiment and use your Oura Ring or your Fitbit, whatever you have, your smartphone, and see, I did this today. How did that affect my sleep? Everyone's a bit different. These are general rules because they have been studied. There's evidence behind it, and they generally work. But for some people, it might be a bit different, right? So use your body as a bit of an experiment. Try something, see if it works. And then if it doesn't, try something else. Okay. I think this is the last question I have. Oh, yeah. What should you do if you have a bad night of sleep? So go to bed earlier that night, sleep in the following morning to catch up on your sleep, have a nap, have one extra cup of coffee midday, or do nothing. So hopefully you're not reaching for that extra cup of coffee, because we talked about how that's going to make that night's sleep worse. We talked about naps, right? So if you're not sleeping well at night, the napping was going to decrease your drive to sleep. Going to bed earlier that night, it can make you wake up a bit earlier, right? And sleeping in again is affecting your sleep routine. So essentially, it's do nothing. So I listen to Matthew Walker a lot. As I said, he's great. He's on Masterclass. He's got audiobooks. A lot of my research is around Matthew Walker. But again, it's do nothing. You just want to go about it at the same time and then try to reset it. Okay. So this is Dr. Matthew Walker's top sleep tips. So bad night of sleep, do nothing. Just live your life, get through the day, go to bed the next day. Okay. Have a wind down routine. He says, don't count sheep. He says, visualize something. So visualize something creative, a walk in nature, being somewhere fantastical, let your dreams kind of take you in your imagination. He's a strong proponent of journaling, especially people, have a list of things to do. I do this as well. I have a whole list of things I need to get done the next day. If I don't write it down, I'm up all night thinking about those things. And there are things like, oh, go grocery shopping. It's not even, there's small things, but they can weigh on your mind. So I always write down, okay, what do I have to do the next day? I send myself an email or a note or something. It's done. Okay. So now I know what I need to do the next day. I'm not thinking about it. So journaling can help people who ruminate and have a to-do list that feels like it's never ending. And then again, removing clocks and phones from your room or keeping it further away if you need an alarm clock. Okay. So this is, Julie, who had trouble falling asleep, was drinking coffee, feels on edge, was stressed out. What did we do for her? Well, we stopped the caffeine cycle, right? We had to stop the caffeine cycle. We had to optimize nighttime routine. We had to rethink her work. We had to use some supplements. We had to look at creative outlets, return to nature. And then again, talking about the 1% rule. So doing one or two things, which inevitably will have a rebound effect, right? So if you're sleeping, if you pick one thing like exercising in the morning for 10 minutes, you're probably going to feel better that day. You're probably going to sleep better. You're probably going to eat less junk food, right? It has a ripple effect. So usually when I'm coaching patients, I say pick one or two things that you think are easy wins that you can do fairly easily, get them down, knock them out of the park, and then start adding things. And you're going to feel more confident with behavior change when you tackle the easy things and you see the positive effects of that than if you're starting with something really hard and challenging. I don't know if you guys all guess, but I think I'm Julie. I will say that I had really bad insomnia for a very long time. So I share this story with patients because sometimes when you're in the depths of not sleeping well, you think it's never going to end, right? You can just get into that cycle where, you haven't slept properly for months and months and you can get really stuck. But I will say that things can reverse. It takes time, and I've done a lot of research and work around sleep. And I make sure that I protect my sleep because I have had insomnia. And so I share this with patients. I'm sharing this with you because it doesn't, doesn't change overnight. It takes time. And now, I sleep much better. And even if I have a bad night, I can bounce back better, right? So I don't stress about, oh, I had a bad night. Oh, something happened at work. I can let it go a bit more. I have my toolbox. I know what I need to do at night and I just bounce back. So if you are suffering from insomnia, hopefully some of these tips have helped. It does improve over time. If there's an underlying medical disorder, please go look at that and get that tested because you have to address the underlying disorder, right? So again, I always end my lifestyle medicine talks with this. You're not your genes, right? We can make small incremental changes, return to nature, return to creativity, return to good, healthy food, healthful habits, managing stress, and slowly things do change for most people. Okay. So again, if digital tools, I've just listed a couple. I use the Calm app. I listen to meditations and things, but whatever works. Red light therapy. There's some evidence that it might help enhance melatonin production. I wouldn't go and spend thousands of dollars on a red light therapy. If you've got access to one, you can try and use it. If you want us, if you've got a Fitbit or a smartphone or something that's tracking your sleep and you want to use it, do that. But again, don't get anxious about it. Some people, if they're just using like the Aura ring for a while. I was using it and I got really anxious because I was like, oh no, I didn't get enough deep sleep, and now I'm ruminating about it, right? So you got to be careful when you're measuring things. Use it for research so you know what works and what doesn't work in your body, and then you don't have to use it all the time, right? Especially if you're feeling anxious and overwhelmed with that. And then these are just resources. Did that disconnect?
No?
Oh, it's still there.
Yeah, yeah.
Okay. Oh, sorry, it disconnected on my screen. But Matthew Walker is great. He is, done a lot of research on sleep. He has books. He's on YouTube. He's on Peter Attia as well. So listen to him. He's got some really great tips on sleep as well. So hopefully you found that helpful.
Oh my
And I think
God.
we have
Yeah,
some
this was
questions.
yeah,
Yeah.
this was so helpful, Sheila, and thank you so much for covering this. And just to summarize, like because you have really covered some deep insights, and so just to summarize, like what you have said. So a lot of us think that, okay, I need to get more done and I don't have time to get a full night's sleep. But what you're saying is you need between 7 to 8 hours of sleep to have a brain that actually makes good decisions, regulates your emotions, and has appetite control. And if you're not sleeping enough, obviously all these areas are going to be affected. And the other thing that you mentioned is, let's say, even if you think that I can't turn my brain off and maybe I need a sleeping pill, but if like there is no sleeping pill that is without side effects or risk to your memory or cognitive uh, performance, you need skills, not pills. So technically, like, you need that lifestyle change, right? And sometimes we think that there's nothing I can do about my irregular sleep and wake times. And thank you for sharing your story, where you're saying that there is a lot that you can do to um, you can do to compensate for the effect of your sleep. Like, you can take actionable steps to manage your internal sleep. And even if you have insomnia, there is hope, like where you can have this uh,
Yeah.
I mean, just by improving your lifestyle you can do that, right? And I'm glad you also covered this myth that you're not supposed to take naps if you want to have good sleep. But short naps, like less than 30 minutes, can be actually beneficial and improve your alertness. And I loved this one when you said, okay, because people think that you can catch up on lost sleep. But the truth is, while you can recover from one night of poor sleep, but consistently not getting enough sleep has consequences. So
Yeah.
so I mean, I love like how you have covered all this myths, and what we are hearing from you is the best approach is to keep a consistent sleep schedule, so that
Yeah.
and as you said, this is something that doesn't happen overnight, but we can definitely work towards it, right?
Yeah, and I mean, we all have busy lives and juggling, and that that rumination and that can really have an effect
Uh-huh.
on people. And I've been through it, and I know how bad it can get. And at some point, so you have to kind of look at your life and say, is it worth kind of the health consequences, right? Because
Mhm.
poor sleep has a lot of health consequences. But some people feel really disempowered, and part of me, kind of sharing my story was to say things can help. There's lots of more evidence out there with, sleep researchers coming out and talking more about it. We're prioritizing sleep. When I see patients, I write a prescription like prioritizing sleep, because now it's a medical thing. Your doctor's telling you to do it, you must do
Yeah.
it, right? But it is that conversation, and it is not something, for some people they sleep great and it's not a problem. But I think more and more people are having trouble with sleep. And I think the biggest thing is, changes in what's happening in our society, the busyness, the chronic stress that we're taking on, the phones are definitely not helping, right? So you have to take actionable items, and you have to do it consistently, right? You can't do it one day and say, oh, it didn't work, so it didn't work. No, it takes months, and you have to be consistent with it. And then, for the most part, it will work, right? You still have bad days. A health journey is never linear, right? There's going to be ups and downs, but what you'll notice is that if you do suffer from chronic insomnia, that your sleep will improve overall, and you'll have less bouts of those sleepless nights. And when you do have a sleepless night, you'll have all those tools, right? Because you know them in the back of your head. So it's practice, practice, practice. Yeah.
Yes, yes.
Yeah.
And yeah, so this has been an amazing talk, Sheila. So thank you
Thank
so
you.
much for
Oh, my pleasure.
yes, spending this evening with us and increasing our awareness about sleep. And I really loved, I mean, especially that 4 to 5 things that, okay, are you falling asleep while watching TV? Are you falling asleep while reading? So
Oh,
yeah, so
Shobha, you're going to make some changes in the new
yes,
year, right?
yeah, because we think, oh, it's normal. But I'm glad, like you pointed those things so that at least we can be aware of it now. That
Exactly.
okay, that we need to take care of it, pay attention to it, and
Yeah.
yes,
Yeah. Yeah.
and take charge of it. So thank you
Yeah.
so much, and we have
My pleasure.
wonderful comments for you here. So
Oh, thank
so
you.
people are saying great info. Thank you so much. So thank you so much.
My
And
pleasure.
so this is actually like this session was also special because this is the last session for our entire year. So we wish you happy holidays, happy Christmas, happy New Year, and we will see you next year. So thank you so much, Sheila, for being part of this wonderful wellness chat. Thank you so much.
Thanks for having me. Happy holidays and happy new year to everyone.
Thank you so much.